To Japan now, where the Tokyo governor said they may reconsider declaring another emergency. Dennis Liu joins us live from Japan. Hello, Dennis.
Hello, Alma. Good evening.
Good evening. Seems there is
In
a
Japan,
spike in cases there.
yes, Alma. Tokyo governor called for restaurants, bars, and karaoke parlors to shut earlier as the capital reported a record number of new infections. Tokyo Governor Koike Yuriko says you may have to consider declaring a state of emergency as she reported a single-day record of 463 new coronavirus cases on Friday. This is the first time Tokyo's daily tally has surpassed 400. Koike told reporters that if the situation worsens, the Tokyo metropolitan government will have to consider declaring its own state of emergency to contain the virus. Again, requested that establishments serving alcohol and karaoke parlors close early to prevent a further spread of the virus. This will be effective from Monday through the end of August. Meanwhile, in contrast to Tokyo's governor, Chief Cabinet Secretary Yoshihide Suga reiterated the government's stance that Japan did not need to reimpose a nationwide state of emergency. He said the current trend in infections was different from that of the first peak in March and April. That time, there was a greater number of serious cases and infections among the high-risk elderly population. Those under 40 with mild or no symptoms have accounted for up to three-quarters of recent cases, and clusters at bars were blamed for much of the upsurge. The nationwide total expanded to 35,461 on Thursday, including some 700 from Diamond Princess cruise ship, which was quarantined in Yokohama in February. The death toll stood at 1,020. Meanwhile, the Foreign Ministry said Japan is set to allow the return of all foreign nationals, including international students and workers, with valid visa statuses who had left Japan before the entry ban was imposed. They began accepting applications allowing some workers and international students to come back into the country starting next week. Foreign nationals, regardless of their nationality, can seek such permission and will be allowed to enter once they meet entry requirements. Meanwhile, in another news, in Fukushima, Japan, a construction worker died and 19 others injured when an explosion occurred shortly before 9 a.m. Thursday, immediately after the worker entered the Shabu Shabu hot pot restaurant in Koriyama, Fukushima. Police and firefighters suspected that propane gas had leaked overnight and filled a restaurant under renovation before the deadly explosion happened on Friday. Hiroshi Furukawa, a 50-year-old on-site supervisor responsible for the renovation work, was found dead at the explosion site, and 19 others in their 20s to 80s were injured. The shop had been temporarily closed since April amid the COVID-19 outbreak and was scheduled to reopen next Monday, the company said. Investigators found damaged parts of the gas pipes installed inside the building. Propane gas cylinders were also found outside the building were all damaged. Investigators believe the cause of damage was due to the explosion, according to some sources. This is the latest for now, Alma. Back to you.
Okay, thank you very much, Dennis. You do take care and stay safe.
Thank you very much. Alma reporting live from Tokyo, Japan. This is Dennis Liu. We live in interesting times.
And not so good news from Vietnam. Joining us live from Da Nang is Ralph Wandolph Empire. Hello, Ralph. Are you still in Da Nang? Am I right?
Hi there, Alma. Yes, I'm still in Da Nang. I'm currently stuck in Da Nang at the moment.
And yes, not so good news. You've recorded the first death in Vietnam.
That's right, Alma. Vietnam has recorded its first COVID-19 related death, a 70-year-old man with a number of underlying conditions. The patient died today, this morning, of a heart attack at Hue Central Hospital in Tua Tien, Hue Province, where he was being treated for coronavirus. The man, a resident of Hoi An Town, also had a number of other health issues, including serious kidney failure, hypertension, and high blood pressure. On July 9, he was admitted to the Department of Internal Medicine and Urology at Da Nang Hospital after suffering from chest pains. 3 weeks later, as more and more cases emerged linked to the hospital, he tested positive for COVID-19 and was placed in isolation on the same ward to begin treatment. On Thursday, he started to suffer from respiratory failure and was put on a ventilator to help him breathe. He was transferred to Hue Central Hospital on Thursday night in critical conditions. Not long later, he went into cardiac arrest, but medics managed to start his heart beating again. The following morning, in the early hours, he suffered another cardiac arrest, but this time, doctors were unable to save him and he was pronounced dead around 5:30 a.m. Friday morning. It is understood both his son and daughter, along with the neighbor who visited him in hospital, have all tested positive for COVID-19. Now, Alma, in other news, Da Nang is to build field hospital and deploy mass testing for COVID-19. Da Nang will begin its mass testing for all local people to eliminate possible SARS-CoV-2 infections in the community this weekend. Director of the city's health department, Ngo T. Kim Yen, told Vietnam News at least 8,000 medical samples could be taken each day for testing at the city's Center for Disease Control, or CDC. The city also plans to deploy a field hospital at the Tien Son Sports Center for possible COVID-19 patients in the coming days. The five-story center, covering 30,000 square meters, could provide thousands of beds for patients. At least 1,000 volunteers from medical colleges and health schools, as well as 400 police officers, will track COVID-19 patients' close contacts. Da Nang and Tuo Tien Hue province are providing medical checks and health declarations for people traveling from Da Nang to Hue at checkpoints in Phu Loc District, Hai Van Pass, and at two sides of the Hai Van Tunnel. Quang Nam province also expanded social distancing measures after Hoi An limited travel. And Alma, just this evening, Vietnam confirms 37 new COVID-19 cases. 26 of them are foreigners or repatriated from overseas. The remaining 11 infections are linked to hospitals in Da Nang, currently the nation's COVID-19 hotspot. Back to you, Alma.
All right, thank you very much, Ralph, for your updates there. And you do take care of yourself, protect yourself there in Da Nang.
Oh, by the way, Alma,
Yes.
I forgot to say that here in Da Nang, the roads are quiet and all stores are closed except supermarkets and pharmacies. And just earlier this afternoon, I received a call from the local government here telling me that they're arranging a free hotel accommodation with free meals to all tourists who are currently stranded in Da Nang. But when I asked about the transportation, going back to Hanoi, they told me that there's no chance at this moment.
Okay, so do you know how long you're going to be there?
Well, at least minimum of 15 days. And then after that,
We'll see.
They will maybe send us an SMS or call. They will give us a call.
All right, thank you very much, Ralph. Do take care of yourself, and thank you for your
You're
updates
welcome,
there.
Alma. This has been Ralph Mondolf Empire bringing you the latest updates here in Da Nang, Vietnam. We live in interesting times.
Meanwhile, European neighbors are worried about the surge of coronavirus cases in Spain. Joining us live from Spain is Beverly Madrid. Hello, Beverly.
Hello, Alma. Thank you for having me.
Good evening
Yes,
from Manila.
I'm from
Yes.
Spain.
Yes, go ahead.
After Britain's quarantine move and a travel warning from France, Germany became the latest country to advise Tuesday against holidays in Spain with a surge in virus cases. Many are preparing for a holiday after months of lockdown. Many are concerned about what they might bring home, with Berlin warning against travel to three areas of northern Spain, including the hugely popular Catalan coast. The call followed warnings from France against travel to Catalonia and Britain's decision to quarantine anyone arriving from Spain for 14 days. As one of the top tourist destinations, It has been a major blow to Spain, which relies heavily on British tourism. Prime Minister Pedro Sanchez quickly hit back at the move, denouncing it as unbalanced and insisting Spain's most popular tourist destinations might even be safer than the UK. We want to send a clear message. We are a secure destination that has made preparations and strengthened itself to deal with the virus and any outbreaks, said government spokeswoman Maria Jesus Montero. But British Prime Minister Boris Johnson defended the decision in light of the signs of a second wave of the pandemic in Europe. Madrid had wanted an exemption for areas like Canary Islands or the Balearic Islands, where there has been a very low incidence of the virus, but London refused. In Spain, where the virus has claimed more than 28,400 lives, there has been a surge in cases in recent weeks. According to Tuesday's count, an average of more than 1,800 new cases per day have been detected over the past 7 days, two-thirds of them in the northeastern regions of Catalonia and Aragon. It's a figure which has more than tripled in 2 weeks, prompting Spain's autonomous regions to step up security measures. The Madrid region moved to make mask wearing obligatory at all times in public on Tuesday, even while having a drink at a bar terrace, where gatherings will now be limited to groups of 10. Restricting numbers to a maximum of 10 guests has also been recommended for people entertaining at home. Although less affected by the recent outbreaks, Madrid has decided to ready a field hospital at a conference center on the city's eastern outskirts. But Catalonia, where the virus has flared up, has taken more drastic steps, and on July 18, advised 4 million residents in and around Barcelona to stay at home. Even so, tourists could still be found visiting the city, saying they felt safe, with British yacht skipper Paul Callahan, 62, telling AFP TV he felt safer in Spain than back home. And Ines Meinen, a 53-year-old hotel employee from Germany, says she too felt safe. Although Spain is the country with the highest instance of cases per 100,000 people, other European countries are also struggling to contain outbreaks. Belgium has toughened the rules after a worrying surge saw virus cases rising by more than 70%, imposing a curfew in its second city, Antwerp, limiting gatherings and making face masks compulsory where social distancing is not possible. The rapid rise in numbers in Germany is also very worrying, top health experts said on Tuesday, urging citizens to keep their distance and wear face masks. And Greece said it was making masks compulsory again in shops and public services after a recent rise in infections. Back to you, Alma.
All right, thank you very much, Beverly, for your updates there. Thank you, EBC Spain Bureau.
Thank you, Alma. Reporting from Barcelona, Spain, I am Beverly Madrid, and we live in interesting times.
Thank you, Bev. Now, Australian officials were eyeing tighter restrictions in the nation's second biggest city Friday as hundreds more coronavirus cases were recorded despite more than 3 weeks in lockdown. As Greater Melbourne passed the halfway point of a lockdown initially intended to last 6 weeks, Premier Daniel Andrews said the state would be stuck in limbo unless it could cut the infection rate. Meanwhile, here's Professor Michael Kidd, Deputy Chief Medical Officer. Let's listen in.
This is a national up. In the past 24 hours, 651 people have been diagnosed as new cases of COVID-19 in Australia. This is the second largest daily number of diagnoses of COVID-19 in our country, only preceded by yesterday when we reported 747 new cases. The level of new diagnoses remains concerning. 8 days ago, we had over 500 cases reported for the first time, and the trend continues to be upwards. 16,905 people have now been diagnosed as COVID-19 positive in Australia. Over the past 24 hours, 627 of these new cases were in Victoria. 21 new cases have been reported in New South Wales. 2 of these are overseas acquired, and these people are in hotel quarantine, and 16 cases have been locally acquired. The people who have died in the past 24 hours were aged in their 50s, 70s and 80s.
Mainly I'm concerned for our children, their education side of it, because it can be affected by it, and even the economy.
It's sad. It's concerning. People are anxious. People are starting to feel depressed because, they can't leave the house. All you do is go to work, come home. If you're working, if you're unemployed, you rely on government social security sort of thing. So, like a lot of other countries like New Zealand, they've overcome the problem. So maybe we should go into a harsher lockdown and get it done and move on.